that is plaguing African kids. While they are stricken with illness and poverty, malnutrition seems to consume their lives. Meanwhile, American children are feeling the wrath of a poor diet and lack of physical activity in the form of severe obesity. The purpose of this research is to discover the causes and lifestyle choices that lead to obesity. Obesity is defined by Merriam-Webster as a condition characterized by the excessive accumulation and storage of fat in the body. Two significant external factors that play into obesity include lack of physical activity and poor dietary habits. These two factors are what have fueled the research, and the hypotheses that have been developed revolve around these factors. The Youth Risk Behavior Surveillance System monitors 6 risk factors, and of the 6 factors, 2 of them are physical activity level and dietary habits. The Hispanic ethnicity notoriously has issues with their weight, so 2 hypotheses were developed in hopes of cracking down on the culprits of what causes childhood obesity among this ethnicity. The 2013 Youth Risk Behavior Surveillance System concluded that 16.2% of Hispanic children reported that they did not participate in at least 60 minutes of physical activity in one day. The Youth Risk Behavior Surveillance System also concluded that 22.6% of the Hispanic children surveyed drank a can of soda 1 or more times a day. The ability to disable external factors from playing a significant role in children's weight could substantially help future generations. Childhood obesity is an issue that has become extremely prevalent in recent years. Although it is not new, it is largely caused by external factors and lifestyle choices. Obesity is such a big issue because it leads to other health issues, and at such a young age, it can cause lasting complications. The purpose of this study is to examine the contributing factors of childhood obesity and possible interventions. According to the Mayo Clinic, childhood obesity is defined as a serious medical condition. Children who are obese are above the normal weight for their age and their height. The Youth Risk Behavior Surveillance System outlines risk factors which include behaviors that contribute to unintentional injuries and violence, sexual behaviors related to unintended pregnancy and sexually transmitted diseases, alcohol and other drug use, tobacco use, unhealthy dietary behaviors, and inadequate physical activity. The Youth Risk Behavior Surveillance System is a self-response survey, so the information received is fully based off of the survey taker's opinion on themselves. Some external factors that may play a significant role in childhood obesity include, but are not limited to, lack of physical activity and poor dietary habits. These 2 factors are what influenced and fueled the research for this study. This research is important in pinpointing the lifestyle factors among children who are overweight or obese. The data can be used to form interventions with the aim of initiating lifestyle changes in these children's lives. The main research question regarding this topic is, what is a correlation between physical activity and Hispanic children that are obese or overweight? The Youth Risk Behavior Surveillance System uses a method based off of school surveys. The survey is conducted during the school day. The students taking the survey record their own thoughts regarding their current lifestyle habits. Participants that partake in the Youth Risk Behavior Surveillance System include the youth among America between the ages of 12 and 21 years of age. The number of participants ranges roughly from 1,200 participants all the way to 15,000 participants. These participants include both sexes, all ethnicities, and all sexual orientations. The research design used for this study was a survey instrument. The same survey was distributed among middle school and high school age students. The survey collects information regarding risky behaviors. The instruments used in this study were free response surveys. Questionnaires were focused on risky behaviors. These include physical activity, dietary behaviors, alcohol and tobacco use, obesity and overweight control, and unintentional injuries and violence. The procedure for this data collection was data was collected for this study through surveys distributed among high school and middle school age students throughout the United States. Participation was voluntary, and results provide the government with a glimpse into what is going on among youth around the country. According to the Centers for Disease Control and Prevention, the percentage of children with obesity has more than tripled since the 70s. The Merriam-Webster Dictionary defines obesity as a condition characterized by the excessive accumulation and storage of fat in the body. Some external factors that may play a significant role in childhood obesity include lack of physical activity and poor dietary habits. These 2 factors are what have fueled the research, and hypotheses have been developed around these factors. A null hypothesis regarding childhood obesity is that there is no statistically significant relationship between obesity and external factors. An alternative hypothesis to this null hypothesis is that Hispanic children who drink sugary drinks are at a higher risk of obesity than those that don't. Another alternative hypothesis is that inadequate physical activity among Hispanic children leads to obesity. The 2013 Youth Risk Behavior Surveillance System provides the government, state, local, and national with information regarding 6 types of health risk behaviors that contribute to the leading causes of death and disability among youth and adults. These risk factors include behaviors that contribute to unintentional injuries and violence, sexual behaviors related to unintended pregnancy and sexually transmitted diseases, alcohol and other drug use, tobacco use, unhealthy dietary behaviors, and inadequate physical activity. The 2013 Youth Risk Behavior Surveillance System concluded that 16.2% of Hispanic children did not participate in at least 60 minutes of physical activity. The Youth Risk Behavior Surveillance System also concluded that 22.6% of these children drank a can of soda 1 or more times a day. The model used an observational approach. This approach was chosen because it simply observes natural occurring events and it is non-interventional. In this case, a snapshot design was used. It was used because data was collected in a very short amount of time. The Youth Risk Behavior Surveillance System collected data in the form of a survey that was distributed to youth among America. The biggest threat to this study is statistical regression. This means that if a population is selected because of qualities that are above or below the population as a whole, then these outliers are likely to regress back towards the mean of their own accord. For this study, students who choose to respond to the questionnaire may differ from the general student population. The YRBSS computer software was used in the research to analyze the data provided by the Youth Risk Behavior Surveillance System. According to the data provided by the Youth Risk Behavior Surveillance System, spelled out and translated by the SPS software, there is a strong correlation between sugary drinks and obesity. Through the data collection and analysis, we reject the null hypothesis that external factors do not influence a child's chance of obesity. The null hypothesis is rejected because the data provided a clear correlation between sugary drinks and a lack of physical activity leading to obesity. We fail to reject the 2 hypotheses: Hispanic children who drink sugary drinks are at a higher risk of obesity than those that don't, and inadequate physical activity among Hispanic children leads to obesity. The percentage of children who drink sugary drinks and the percentage of Hispanic children who are obese are both rather high. The same is true for the physical inactivity theory. Had the rate of physical activity been higher, there would also have been a change in the number of obese Hispanic children. If this data is taken seriously, it can affect future generations in a very positive way. The Youth Risk Behavior Surveillance System has made great strides in the health of America's youth. It displays the risks that are greatest among different ages, ethnicities, and sexes. The data obtained by the Youth Risk Behavior Surveillance System helps researchers and government officials form a plan of intervention for this age group. Results were not what was expected. Before evaluating and processing the data provided by the Centers for Disease Control and Prevention, the assumption was that African American children would have a higher likelihood of obesity or being overweight. However, that was not the case. Hispanic children and youth reported that they found themselves to be in a risky situation with their weight. One change that can be made to this study is improving the questions that are asked. The data that is obtained can only highlight risk factors. To make a change in the lives of the youth taking the survey, action should be made regarding the red flags that children report. What makes that tricky is the fact that the survey is completely anonymous. However, the anonymity of the survey allows legislators to come up with reforms that can target the entire population with a focus on those that are high risk. Moving forward, combating childhood obesity needs to be a main focus of local, state, and national legislators. This is an issue that is not going away anytime soon, and it is an issue that needs to be addressed now. The state of the children of this country needs to improve. And to do so, we all have to collectively come together to make a change in the lives of these children. That starts with the parents, but it can be enforced throughout school and throughout other aspects of life. Obesity is something that needs to be targeted so that it doesn't plague these children for the rest of their lives.